Are you suffering from a frozen shoulder, or perhaps you know someone who is? Welcome to our deep dive into frozen shoulder, a prevalent condition causing stiffness, pain, and a limited range of movement. It's more than just an inconvenience. It can significantly impact your day-to-day life. From carrying groceries to even simple tasks like putting on a jacket, a frozen shoulder can make it all seem like a Herculean task. Understand? Understanding frozen shoulder begins with knowing what causes it. So, what exactly triggers this painful condition? Well, frozen shoulder or adhesive capsulitis typically develops when the flexible tissue that surrounds your shoulder joint, known as the capsule, becomes thick and tight. This tightening is often a gradual process, leading to a progressive loss of movement and increasing discomfort. But what causes this to happen? In many cases, it's not entirely clear. However, certain factors can increase the risk. Medical conditions such as diabetes and cardiovascular disease, for instance, are often associated with a higher incidence of frozen shoulder. Thyroid problems, Parkinson's disease, and even prolonged immobility due to a shoulder injury can also contribute to the development of this condition. Lifestyle factors too can play a role. A sedentary lifestyle, poor posture, or repetitive shoulder movements, especially if they involve awkward positions, can all lead to a frozen shoulder. Now that we've explored the causes, let's delve into the telltale signs of a frozen shoulder. How can you tell if you or someone you know has a frozen shoulder? Well, it's important to know the symptoms. A frozen shoulder doesn't happen overnight. It develops gradually, and you might notice a few red flags. Persistent pain in your shoulder is one of the most common symptoms. You might find that it aches or throbs, especially when you try to move your arm. Over time, this pain can get worse and even disrupt your sleep. Another symptom is stiffness. Your shoulder might feel tight, almost as if it's being held in place by an invisible vice. This stiffness can make it difficult to perform everyday tasks, like reaching for something on a high shelf or even just brushing your hair. Limited mobility is another key indicator. You might find that you're unable to move your shoulder as freely as you used to. This could mean struggling to lift your arm above your head or finding it tough to rotate your shoulder. Now, let's talk risk factors. Some people are more likely to develop a frozen shoulder than others. Age is a key factor, with most cases affecting those over 40. Women are more likely to experience it than men. Certain medical conditions like diabetes or heart disease also increase the risk of developing a frozen shoulder. Recognizing these symptoms and risk factors can lead to early detection and treatment. Speaking of which, let's discuss how to manage a frozen shoulder. Feeling trapped by a frozen shoulder? There's a way out. A frozen shoulder may feel like a winter that won't end, but rest assured, there are a plethora of treatment options available to help you regain mobility and control pain. Let's delve into some of these options. First, physical therapy is often the cornerstone of treatment for a frozen shoulder. A skilled physiotherapist can guide you through a series of exercises designed to restore movement and flexibility. These exercises may start off simple, such as gentle stretching, but will gradually increase in complexity and intensity to strengthen your shoulder muscles and improve your range of motion. Next, let's talk about medications. Over-the-counter pain relievers and anti-inflammatory drugs can significantly reduce pain and swelling in the early stages of a frozen shoulder. In some cases, a doctor may recommend stronger prescription drugs or even corticosteroid injections into the shoulder joint to alleviate severe pain. Now, in rare cases where physical therapy and medications don't bring the desired relief, surgery may be considered. But don't worry, these surgical procedures are typically minimally invasive. The most common ones involve manipulating the shoulder under general anesthesia to break up the adhesions. or performing an arthroscopic surgery to remove scar tissue. These surgeries are typically followed by an intensive course of physical therapy to restore mobility and prevent recurrence. But remember, there's no one-size-fits-all solution when it comes to treating a frozen shoulder. What works best for you will depend on your specific symptoms, overall health, and lifestyle. This is why it's so crucial to work closely with your healthcare provider to develop a personalized treatment plan, which may involve a combination of the therapies we've discussed. Remember, every frozen shoulder thaws eventually. With the right treatment plan, you can get back to moving freely and living fully. So, don't lose hope. Embrace the journey to recovery and look forward to the springtime of restored mobility that lies ahead.